headdress doesn't look right to me. One thing about the headdress, folks, is that the head, the neck, the purpose of this is to get the neck nice and straight. Okay? Can I just show it as it was before? Go back and I'm exaggerating now. I'm exaggerating now. But can you see what's happening here? And he feels it too. I've seen that quite a lot here. Okay? So there's another one that's really angled up. So what we're needing is the you're in the webs there, aren't you? I'll clear that in a minute. Yeah, lovely. Okay, that's done it. What we're needing is a nice straight neck there. Okay? See that? And sometimes you need to negotiate. Did you see the way I negotiated that? Like, how does that feel? I'm looking for something that I think looks right for him, but it has to actually feel comfortable. And then we have this nice webbing. How are we doing down there? It's kind of it's not working for me, right? There you go. Better?
Yep.
Okay. So notice what's going on with your clients. If they look like they're uncomfortable, they probably are. Okay? And just ask questions. And then we've got the support here. Right. You look really, feel really hot as well with this on you. Can I take it off? Yeah. So I'm going to just actually take it down. Right. And I was going to show you the towel technique, but we might go and do that later on. Now, having told you all to get your oil ready, I forgot. Can I have some oil, please? Can you grab me an oil? Oh, there you are. What have I got? Somebody brought oil in. Did you bring oil in? Sorry. Somebody brought oil in. Look, drawer.
Sorry, dumped you in there. Sorry to that. I just grabbed it.
Oh, okay. I'm actually going to use this because Draw has told me about something he uses, which is actually relationships. So I'm going to try it. Okay. So we've already talked quite a lot about what compression is, where it fits. Okay. Actually, I might use oil just to demonstrate something else. And what we also need to look at today is body use. So I'm going to just do a few things and see what you think. What do you think about that? Just what's missing? Hang on, that. Is that right? Is that all right? It does, doesn't it? What else needs to change? Anybody want to look at my feet?
Maybe that way.
I need to kind of go in the direction where I'm heading. Then what needs to happen? Right, I'm there now. Now what needs to happen?
The legs.
Oh, I need to bend into it. Okay. What else?
Slow.
Oh, I might slow down a little bit. Okay. Yeah, what else? Is that looking a bit better? Okay. All right. And I could even do that fast pretty well. You know, I can go fast. But all of those things, first of all, I had my feet turned in here. I wasn't going anywhere. Okay, so what am I doing? Effleurage, petrissage, what have we said about where it fits with massage? Where does compression fit? In the deep bit. So light, medium, deep, and back out to light. Or maybe some medium and then deep again and then eventually back to light. So there's a process. So I'm warming these muscles up. Remember what we said about warming everything up before you go deeper. I'm already doing the technique there, you see, it's a habit. Okay. How's that feeling? I'm trying to think. I'm thinking. This is my thinking. Okay. So imagine I've done an awful lot more than that. What if I had loads of oil on here? What would happen?
You wouldn't go very deep.
Huh?
You wouldn't go very deep.
Why is that?
Because your hands would slide.
My hands would slide. Yeah, absolutely. So when you go deeper, you need less and less oil. In fact, you can do a lot of the deep stuff without any oil at all. That is too slippery for even me. So I have my own ways of getting rid of slippery oil. Okay, all right, so here's this first one I'm going to show you. So one of the ways to do compression, you see these muscles here? He's perfect for showing you the erector. You can call them erector spiny. I think Draw says spiny. But they're a group of muscles along the sides of the spine. You can see his beautifully. And very often people have tension in these areas.
Yeah,
how does that feel?
That feels exactly.
Okay.
Yeah.
See what I mean about how reassuring it is to people? And what I'm actually doing is feeling both sides to see which bit is the worst, okay? And I'd say it's around here.
Yeah, I would agree.
Okay, so what we know about compression is that actually what we're going to do is press and lean in. So I might want a slightly different posture on that, because I'm going to do it for a while. How does that feel? I'm going to, but I just want to know how that feels.
Yeah, nice.
Okay, let me just go in a little bit more. So if I'm going in a little bit more, I don't want to use too much pressure on my thumbs, okay? I really don't. And I very rarely use thumbs like this, but it's one way you can if you're not going to use that much pressure, okay? So a thumb horizontally either side, and I'm going deep now into the erector muscle there, okay? But I can't get enough purchase there to do anything deeper than that. How does that feel? Notice the communication? Okay. So one way of getting deeper is to use one thumb on top of the other. How does that feel? Okay. But even so, I can feel a slight strain on my thumb there. And I don't like straining my thumbs. So here's what I'm going to do. I'm going to use the other hand. I'm going to rest it. See where it rests? Do you have a go at that? It kind of rests there. You don't need to look, I'll make sure you get to see this. And so, what's using the pressure now? Where's the pressure coming from? Yeah, the hand on top. So now that thumb becomes just a tool. So there's no tension on my thumb, and I can press in there. How's that feeling? Yeah, and I'm going to did you see me adjust my posture so that I can lean in more? Good. And all I'm doing is leaning in. And when you come out just as slowly. What else? See, look. That's how deep I was. What else could you use? Do you want to go with that one first? Fingers, reinforced fingers. So I might, no, I wouldn't do that. I'd do that because I want to actually get in there.
Are you using the tips of the single pads?
I'm using the pads. This is where, really, the pads I'm using. This is where you need your nails short, right? I could use the heel of my hand, depending on how big an area I'm working on. I could use knuckles. Now, those knuckles there would be perfect for me. Notice the reinforcement again, because you don't want to be slipping into the spine, right? So you need to be a little bit careful of what you're doing deep. How's that feel? Okay. How painful should this be?
Well, I was thinking that, and it's on the border of sort of like, relief as well as pain.
Yeah, that's what I was saying earlier, wasn't it? It's like a good stretch. It feels good. Okay, so it's on the border. So out of 10, what would you say that was?
7.
Okay.
6, 7.
6, 7. I wouldn't say to go any more than that. And you notice the communication there? So out of 10, what would that be? Okay? If he started to say 8, I'm backing off at that point. Okay? And I'm just taking the pressure off at that point. So I generally work with people a lot around what they say. So I'm going to recap with you. 2 thumbs. I can't get very far in, but if that was a light woman, a slight woman, that might be plenty, okay? 1 thumb on top of the other. Fingers reinforced. Knuckles. Now remember I said you can go along the fibres, so I'm going to press in there and go, how are you doing with that? Good, okay. So I'm going along the fibres there, and I can go across the fibres there. I could go across the fibres there too. I do a lot of that. Okay? Let me just check my notes. And then I'm going to start showing you where else I work. Fingers, knuckles, elbow. So here's what I would do as well. If I'm working with an area that's tight, sore, I'm going to come back to that reinforced thumb. Okay, let's find the bit that really is there. Okay, there?
Yeah.
Yeah. So what I want you to do is to breathe with that. Nice deep breaths. Can you see what I'm doing? Just using his breath, and each time he breathes out, I'm going a little bit deeper. How are you doing with that, Yusuf? It's good? Feel good?
Yeah.
Is it easing?
Yeah.
Good. So I'm not going anywhere. I'm getting him to do the work, really. Which is what I always do. I told you, didn't I? Okay. All right. How are you feeling with that? Let's just use something else. So the other thing, nice. The other thing that I might use is the elbow. But actually, let's go in here. Sorry, Dawn. Okay, so we did some of this, didn't we? Mm-hmm. Didn't we do a lot of that? So that was getting used to you kind of using your forearms. So now you can use more of the actual elbow. I still have quite a large surface area placed on there. I can do it without my hand underneath. That's fine, so I can press in like that. Notice the really soft wrist. Or I can use my hand underneath and begin to bring the elbow up. Now, why use the hand there?
Keep the arm soft.
It keeps the arm quite nice and soft. That's a good point, good point. Why else? Hey? Yeah, I'm not going to slip anywhere like this, okay? And also I can really guide that forearm. So I could be really nice and flat, 1 minute, and then I can guide the forearm into more of a point, and the more of a point it is, the deeper it is. Are you okay with that?
Yeah.
You sure?
Yeah.
Okay. Right on, right? Okay. So, let me just check. Erectors. Oh, I've got to show you the upper trapezius. Okay, yeah, good. Hold that for me. Right. All right, so I've worked in a very specific area here because that's where I could feel he had most of the tension. But you would not do so much concentrated work in one area, please, okay? I've done it because I wanted to show you all the different techniques. But, you know, just try them out in different places. Now, how would you do the same thing in the upper trapezius? What are you going to do here? So, levator scapulae here. Comes up into the neck. Upper trapezius. Up here. Most people get an awful lot of knotting. Have you noticed? Here, okay? Up here. And also medial scapular borders. Now, can you see, while I'm going over that, the difference between the left and the right? Anybody see that?
This one is
Yeah, the left-hand side
just has a slight bump.
Slight bump. Do you want to feel it? Do you mind,
if you
Yusuf?
feel it, if you felt it, I know it would be more.
Feel
as
it.
in, yeah.
Feel it.
From here you can see that it's like that on one
Yikes!
side.
It's our client here. Okay, so, you know, that's an area I would want to work with the deeper techniques after warming the area up, definitely. But also up here. So what can we do up here? What could we do? What could we do?
Knuckles.
Forearm? No? Forearm? Leaning in there. Again, I would want my hand there to stop me slipping in there. It's quite a useful thing to get into the habit of doing.
You don't want to slip down and elbow him in the head or something.
Okay?
You don't want to slip down and
My
hit him in the head.
force is that way, so I'm not going to slip that way. I would have to actually be here to slip that way. So the force is that way, and I've got good control because of my head. Okay? What else could we do?
Knuckles.
Knuckles, great one. Knuckles. Great. Knuckles work very well. Now, can you kind of get that one knuckle? That one knuckle can be really, really useful. Yeah. Really. The more you start to use each part of your hand, the better. So there I'm using those, but then I could go to one. Great stuff. Or these. I think we did a bit of that, didn't we? Now, that's petrissage because I'm moving. But if I actually use knuckles and hold there and press and go across the fibres in a small area, that's compression. Feel the difference? So petrissage movements, even an effleurage if I do it light, but petrissage and then compression is pressing and moving in a small area. Okay? What else could I do?
Fingers.
Fingers, yeah. Not so easy, but I could.
Your elbow.
I did that. Yeah. But how about reinforced thumb? That's my favourite. That's my favourite. How's that feeling? How painful?
Hey, if you move sort of like about a centimetre to your right.
Yeah. Okay. How's that feeling?
It was better because I thought it was just too.
Oh no, I'm going to go back to where it was hurting, okay? But tell me how much that is. Because, see, I've just eased off. He said it was painful, so I've eased off. Is that all right now? So you just ease off, okay? You don't want your clients to tense because of the pain. You want to actually address any problem that's there. All right? And I would want to come in here now. So my fingers would probably work in there, yeah? Another place a lot of people get tension is the Quadratus Lumborum. Yeah, so, you know, elbow is quite useful in there, or forearm. How's that feeling? Again, it's another area that's quite tender. And I haven't warmed you up, right? So, you know, I'm doing quite a lot of things without, so I'm just going to show that. And I might also use fists in there. How's that? Yeah? We've done that one. And if I'm working on the legs, which leg was affected? This one, wasn't it? So, same things. Reinforced thumb. Okay? Fingers reinforced. So, very often you'll find nice little bits in the calf muscles. There's a nice one. Can you see as I go over there? You know what we were saying? So I'm going to find the kind of tight bit of that. How are you doing?
Oh, fine.
Is that painful?
No, not at all.
Okay. So that's just, sometimes it's just old tensions in there that aren't giving people any problems. Or it can be old injuries that you pick up on. Okay? How's that feel? And this would be friction. And this. And so what if I wanted to do some compression on the sacrum? I can do that, can't I? We already did it from this position, didn't we? That was actually a compression. But I quite like to do it on the side as well. Okay. Give you some ideas? Okay, so we're going to work in pairs. So I've done this, you can see where I've worked. So I've worked a bit on him, and I do want to actually kind of smooth that down afterwards. And like we said, it has that pumping action. So it's a really good thing to do the effleurage afterwards because that helps with the circulation and lymphatic flow. Okay? Feel good? Remember your body use. Remember, your front foot needs to be in the direction that you're going in. You're leaning forward on that. You're pulling back. All the stuff we did last time, okay? Leaning forward, pulling back. Wherever you are, pulling back. Your bottom has to be stuck in order to do that. The other thing I would say to you, I don't think we've said it yet, wherever you're working needs to be in this kind of hara spotlight, okay? Imagine, this is my hara, okay? Imagine that there's a spotlight coming from this area here. You know those lovely spotlights in cartoons where you get that V? Yeah? Okay. That's what I've got. So this needs to be facing wherever I'm working. So if I'm like that, there's something very wrong, okay? Needs to be in the spotlight. Okay, and this is the part that moves. The other thing that I want you to get used to is the relationship between your hips and your elbows and your arms. So there's always this, if you look, it's almost like an invisible string between the two. Okay? So always moving with your hips and your arms. Or a cushion between the two, sometimes people mention. Okay? If you're side on doing petrissage movements, then there needs to be a kind of lateral side on stance. But if it's push-pull, you need that front leg forward. Got it? What else? What else do you all do? What happens then? I'm exaggerating, just slightly. Hey? Did you know what I was doing there?
Yeah.
How did you know that?
I think your voice just came
Okay,
closer.
I came closer to you. Okay, so keep those backs supported. Keep them upright, you know, so that you're working as one. Okay? Lovely. Okay, well, get your pairs, and you need to practice that. We've done that all around.